Yeah, so someone asked, does the donor scarring change over time?
Scarring of the donor after FUE depend what we're calling scarring. Is it the missing of hair, or is it a butcher FUE that disregard completely the anatomy and the architecture of the donor by just overlapping some punches? If you just massacre the donor by punching all over, what's gonna happen in a couple of years is just less and less hair, because of the scarring will trap the blood vessels, and as I say, most of the hair will grow thinner. So I don't think that it gets better with time. If you destroy things, it don't get better with time. You're gonna get used to it with time, but it doesn't mean that it's getting better with time.
So what is the difference between shock loss and over harvesting, right? Because sometimes you can see a patient who has maybe like 1,800 grafts, and they'll have some shock
Patches.
loss patches where, and the surgeon's a good surgeon, so it's definitely not donor depletion, it's just shock loss. How can you tell the difference between that and the over harvesting?
The over harvesting is just you're going to overwhelm the ability of the square centimeter to heal. So let's say if you have a density of 80, we usually take 1 out of 4 out of 5 follicles. So we usually take between 20 to 27% during the surgery. So if you do that, but for some reason some people bleed a lot, then you use a little bit more epinephrine. And from my experience, I see the shock loss mainly because the patient was bleeding a lot or was burning anesthesia a lot, so we injected a lot. So there are some, I won't say toxicity, but when you use epinephrine, you shrink the blood vessel, and in the crucial healing period time, some of the blood vessels have been shut down, and so don't provide enough of nutrient to the area, and then the hair there goes to shock. And it's usually area around the ears and where you already have finer hair. Probably those are hair that were the weakest one, and probably did not withstand the changing of blood flow, even if it's at the capillary level. But I think that's what creating shock loss. But over harvesting is just disregarding the amount of follicles that need to be taken, and just take and not leaving enough viable tissue around to allow healing to happen properly. Most of the shock loss are temporary, and usually after applying minoxidil, even topical, in 2-3 months they'll come back. But most of the over harvesting, sometimes you see even the skin weeping 2-3 weeks after the surgery, and people still having really bold patch after 6 months after surgery. That is because they over harvest.
Thank you so much for watching our videos, and for more great content, don't forget to hit that subscribe button, and also go to www.bhrclinic.com and start your journey for a free assessment with Dr. Bisanga. Thanks ever so much. Let's get started together, and look forward to seeing you soon.